People don't know that men could get breast cancer, and although it's only 1% of all the breast cancers diagnosed, men can get breast cancer. For a woman, the breast is a very intimate part of her body, so breast cancer is a very intimate cancer for women. And more women are concerned about breast cancer, even though there are other diseases that are more prevalent among women, like heart disease, because it is such an intimate cancer.
The loss of a breast, the disfigurement that can accompany it, is very traumatic for the woman, not only for the woman, but for her husband as well. It affects how their relationship is, their intimate relationship. Men very often talk about they're afraid to touch their wives. They don't know how to resume intimacy, and women are always concerned about, is my husband or my boyfriend still going to feel the same way about me? I think what has been a major step has been that many women today opt for reconstruction at the time of surgery.
Usually we do this immediately at the same setting. So my role in that is advising my patients, and it's pretty much done with a plastic surgeon, so it's a concerted effort. So I help the plastic surgeon with the reconstruction, and she's there during the time that I'm doing the mastectomy as well.
It was called a tram flap procedure, and what they actually do, they cut you from hip to hip, take your stomach muscle and rebuild a breast.
You would have to ask John, but I think he did not want to see me go through that. He did not want to see me lose a breast. He would probably agree that I would have breast augmentation if that was the case, but he didn't want to see me go through the pain either. That's a difficult situation when you find you have breast cancer. First you have to remove a breast or a lumpectomy, then you have to go through radiation and chemotherapy. Nobody wishes that on anybody.
Across the United States, in most developed countries, the death rate has been steadily going down. Over the last, it's dropped slowly by 2% or 3%, but it has been going down, and the survival data is getting better. And I think that's very encouraging for women, and part of that is because there have been screening mammographies. Women have learned to do self-breast exam and to go for clinical breast exam.
We feel very, very strongly that women should be screened, have a mammography screening starting at age 35 for a baseline to 40, and then every year after.
Unfortunately, we see a lot of patients with breast cancer in general, and we diagnose a lot of women under 50, which I consider to be young. Some unfortunately are diagnosed with their baseline mammogram even at 40 or even at 35. So we do see a lot more younger people these days.
Fortunately, so far, the government has said that under Medicare and Medicaid, they will continue to pay for screening mammographies. And I think it's going to be, the women are going to have to rally around again and fight the fight all over again about this is something we need and are entitled to, and we need to continue to have it. You don't have to be on your own to do this. It's not necessary to feel isolated or lonely or ashamed.
My advice is that you don't have to go through it alone. You can reach out to other women and programs such as ours that provide services so that you can get information, you can get support.
It is not a death sentence. There is so much being done now in treatment and in aftercare that women are living longer and longer.
I definitely encourage all women to have their screening testing done and see their doctors on a regular basis so that if there is any abnormality, it is found early, and then prognosis is much better.
Find a good doctor, someone that listens to you, that's empathetic, very, that would not treat you as if you were just another person through the door.
Try to keep a positive attitude. It's devastating. It's okay to feel sorry for yourself. It's okay to cry. No one deserves this. God didn't deem it upon us because we deserve to get this. We don't deserve to get this. We deserve to live a good life, a healthy life.
Life can show no mercy, it can tear your soul apart. It can make you feel like you're gone crazy, but you're not. But things have seemed to change. There's one thing that's still the same. my heart you have remained, and we can fly, fly, fly away. 'Cause you are not alone, and I am there with you, and we'll get lost together until the light comes pouring through. 'Cause when you feel like you're done and the darkness has won, babe, you're not lost, and the world's crashing down and you can't bear the cross. I said, baby, you're not lost. Yeah, yeah, yeah. I said, baby, you're not lost. I said, baby, you're not lost. Ooh, yeah, yeah. I said, baby,